Please. Okay, you can start.
Good afternoon, one and all, distinguished ANEI leaders, respected panelists, and esteemed colleagues. On behalf of ANEI Kerala Chapter, I extend a warm welcome to each one of you for joining for today's panel discussion on evidence-based safe medication practices. I am deeply honored to have the senior executive members of ANEI present with us, and we appreciate your valuable time and support. Your participation and reflects our collective commitment to strengthening patient safety and enhancing the standards of clinical excellence. I welcome Ms. Kamaljeet Oberoi ma'am and Ms. Jyoti Clara ma'am, who is a zonal vice president, zonal president to this session. Before moving to the session, I also want to thank Ms. Tangam Gomes ma'am, the founder president of NEI, and Captain Ajita Nair ma'am, the national president, for guiding us and leading this NEI. Now I hand over to Jyoti madam for her dues. Thank you, ma'am.
Thank you, Amita. Before I could proceed, may I invite Ms. Kawaljit Oberoi. Congratulations. She has taken from January till date all the Empower R and she has made it possible. She has put up with all the challenges. She has supported the team. Thank you so much, Kawal. May I request you to highlight about Annie and then probably I'll speak one or two sentences about the zone.
Thank you so much, Dr. Jyoti. Y'all can hear me?
Yes.
Yes,
Okay.
ma'am.
Very much.
So I think I don't want to take much valuable time of this team because they have a wonderful topic. I am putting this website link on the. I'm putting this website link for all to follow this thing because everything about ANEI is given in this Association of Nurse Executive website. Just to give you a little bit of history behind it, most of the members sitting over here have contributed a lot to ANEI. Currently, our ANEI leadership is led by Dr. Ms. Ajita Nayan, who is our national president, Dr. Umona, who is our national vice president, Ms. Vinci Tribhuvan, who is our national secretary, and Lieutenant Colonel Ajit, who is our national treasurer. Of course, as you mentioned, Ms. Tankam Gomez was the one who is a founder, who has started with this movement. And also now, if you go and see in the website, there are proper vision, mission of ANEI because they are very fortunate this body.
Excuse me.
Bhanu Priya, please mute.
So we do have a vision. I mean, most of the senior leaders of the country have joined together and given a vision for this executive body is to provide leadership, professional development, and research. So most of the activities that we are doing in this ANEI Empower R is one of the very important activities which we are doing, through which on this platform we are sharing knowledge and basis of nursing, autonomy, professionalism, whatever you say, by involving the younger generation of nurses. So in Empower R, what we are doing is we are having mix of senior nursing leadership and the young nurse leaders, as well as the student nurses are also a part of this Empower R. So I will leave it to Amita and the team over there. Please take the team through this and regarding the previous power hours, whatever has been done from January till now, all of those sessions are uploaded in the YouTube. So please, you can follow that and you can go through and you can see what previous chapters and previous sessions have happened. So I hand over to you,
Thank
Amita.
you, Madam. Thank you, Madam Kavaljit. That was a brief introduction. I think there were a lot of disturbance from the back end. May I request all of you to mute if you are not speaking? This would help to make this program effective and efficient. There are delegates who have registered and those who have joined who are interested to listen what is happening. I think we should be supporting. Who is this Bhanupriya? It's coming again and again. Co-host You have the right to mute all of them, those who are not speaking. So please mute those who are not speaking from back end.
Madam, your voice not audible, ma'am.
So when you're mute, no, because the co-host has muted everyone. You have to go to the participant and see who is unmuted. You have to mute them. Co-host, please take care of this, and the host also can take care of it so that all the speakers are comfortable and they are able to. First of things, like it's only online, it's not face to face. Second thing is like they will feel not comfortable when they are speaking in virtual meetings if lot of noise is at the back end. Thank you so much for the cooperation. So to start with, I'm glad and I'm privileged to be a zonal president for this year and the coming year. And I have taken this with additional responsibility only to support the chapter heads. Chapter heads are in the front and I am at the back to support them. Whenever they need support, whenever they need advice, or whenever they need some amount of initiatives to taking forward, or whenever there is a gap that is to be filled, we are available. So there is no hierarchy, there is no above and below or whatever it is only we are working together as a team. So as a team, we have become more stronger because of the zonal introduction. So zonal team will always support the chapter president, chapter vice president, the chapter secretary. Your position, your role, and your individuality will remain the same. There is not going to be any change at all. So continue to contribute, continue to support, all of you should understand that for Kerala, the first person is Amita. And with Amita, Lieutenant Colonel Amita Naze, we also have a secretary, Lieutenant Colonel Majalla Matthew, who is here with us again. You can come on screen, Colonel Majalla. And we also have Sister Likita. Thank you so much, all three of you, for taking up the office. It's not easy to take a position in association. You have to give extra time other than your work. You have to have something forgo with your family activities because most of the meetings are after duty time, and probably it will not be conducive for us to sometime even say I'll not be attending. So thank you so much for having known the importance and accepting the position. I am sure you will be taking Kerala State ANEI to the next level in couple of years. Wish you all the best. And I would like to mention here a special mention for those who have contributed in the past. Ms. Manjula Kannan, President, Lieutenant Colonel Isha, Vice President, and again, Amita was there with them. I think they did a fantastic job. Last 4 to 5 years, being the first exposure and first experience, they have increased the membership. They have contributed to all the activities of ANEI. They also have conducted a lot of their state level programs. And on top, we had an ANECon hosted during their tenure. So congratulations to all of you. You have done a fantastic job. All of us can applaud and thank each and every one of them who were the previous office bearers. You're not gone. You're still with us. Continue to stay with us and let us work towards for ANEI. With this, I hand over back to Colonel Amita. Wish you all the best, Amita. I think you're on the right track. So let us start the program. Thank you so much.
Thank you, madam. Thank you so much for that good words and the motivation words. I think we will be trying to keeping up all your hopes and dreams so that we excel in our duties. Thank you so much, ma'am. So coming to our topic today, we are diving into a topic that sits right at the heart of the patient safety, evidence-based safe medication practices. Medication administration is something we do every single day. At every step carries responsibility. Evidence keeps evolving, and so must be. Today's panel brings together voices from leadership, clinical practice, education, and student experience to help us look at medication safety from every angle. Let me introduce our panelists. Lieutenant Colonel Majella Matthew, CNO, Masleva Medicity and Secretary ANEI, who brings the big picture perspective of system level safety. A highly experienced senior nurse manager, Ms. Sana Joseph from Aston Medicity, Kochi, who leaves medication administration realities on the floor every day. A fifth semester student nurse, Ms. Sri Priya from Srinarayana College of Nursing, representing fresh eyes, curiosity, and learning challenges. Faculty from the College of Nursing, Srinarayana College of Nursing, Ms. Anita Sakriya, Associate Professor from Srinarayana College of Nursing, who shaped the foundational knowledge and skills our future nurses depend on. And I would like to tell you one thing that Madam Sai Bala, Director Amrita, was one of the panelists, but she couldn't join because of some of her personal reasons. So to begin with, let's invite our senior nurse manager, Miss Saina Joseph, who has years of hands-on experience with medication administration. I would love to hear how evidence-based practices translate into real-time decisions in busy clinical settings. So my question goes to her: how do you personally ensure that you follow the 5 rights? The right patient, the right dose, the right drug, the right route, and the right time in your routine practices. Over to you, Sena.
Yes, ma'am. Thank you so much for the wonderful opportunity to speak in this wonderful platform, first of all. And so, in my routine practices, I always make sure to strictly follow the 5 rights as a part of my medication safety protocol. First, the 5 rights, as you said, the right patient, right drug, right dose, and right time, and yeah, right route also. Yeah. So first, how I ensure the right patient, we used to check the patient ID that and patient full name. With we are the way how we are identify the patient correctly, and we also cross check, cross verifying with the prescription and verbal confirmation if possible. Next, we are confirming the right drug by matching the medication label and the doctor's order, and double checking if there is any LASA drugs, like means look-alike or sound-alike drugs, and we are always ensure that it's labeled properly. And coming to the right dose, I carefully always calculating the medication dose, especially for the pediatric patients, and when we are handling the control drugs like narcotics or high risk medications, we ensure the it matches the prescribed strength. And if there is any doubt, we usually confirm with our senior doctors are available on duty, and also we have clinical pharmacists available on the floor, so we always confirm the correct strength by like that. And when come to the right route, always confirm the correct administration method, if it's oral, IM, or otherwise according to the order and the patient condition. Sometimes doctors may prescribe the oral medication, and patient may cannot like take the oral medication due to some issues due to their disease condition, so always ensure by like. Finally, I ensure the right time by strictly following the schedule, like and will document it immediately after the administration. And in addition, I always follow the practice of thinking before giving, and pausing for a moment to recheck everything is aligned. And we are strictly following and encouraging everyone to develop or follow the culture of double checking with our colleagues. So before and after every medication administration, the like the drugs dose, everything should be rechecked by a senior nurse, senior person in the department, so thereby we can prevent a lot of medication errors also. Sometimes staff may miss, but they will find out if there is any problem, because sometimes doctors handwriting may be not legible. So these are the way these routines always help us to maintain the patient safety and makes the medication errors also.
Thank you, Saina. Thank you so much. You told very correctly, think before you give. It's a very nice wordings you have told. That's very correct. because whenever we administer medication, we have to be 100%, dedicated to the place and dedicated to the what you are doing, because this is such an important thing what you are doing. So as you said, some of the hospitals practice, putting some special color, codes for nurses, so that they are not disturbed when they are administering the medication. So that much importance we give for medication administration. So Saina, you said very correct, and thank you so much for enlightening this. And now, next I would like to invite our CNO, Lieutenant Colonel Majella Matthew ma'am, to share the insight on the importance of the evidence-based medication practice at an organizational level. So madam, I would like to ask you that how do supervision, audits, and continuous training contribute to strengthening medication safety, ma'am? Ma'am, unmute. Mute.
Thank you, Amita. Good evening to you all. Training, supervision, and audit work together to strengthen the medication safety by promoting the knowledge and the accountability and the continuous improvement process. So knowledge, for the training, we have to have the process training importantly. So how they have to, we should train the nurses that they should give the medication or they should order the medication. It's based on the doctor's order only. They should intend if they are, the order, if they are ordering the medications. But in our practices, we have the EMR system. So they prescribe the medications and nurse have to, convert into the request. That much only they have to do. But if in case if it is not practicing in many of the hospitals, EMR may not be full-fledged. So in that case, they have to indent the medications based on the proper order of the doctors. And second thing, it should be done by a competent and privileged nurse. So we have to medication shall be when it has come from the pharmacy, this has to be verified by the nurse whether they are getting the correct medications or not. They have to stress upon the the rights of all rights of medications. And the highlight medications, we have to keep it separately. The label should be there. The narcotics, the policy, again, it has to be maintained. So these all trainings, it is a repeated training we have to give the new joinees and the other nurses also, because every time when we do the things, there might be chances of slipping off the things. So we have to make sure that the repeated training has to be given to the nurses, and we have to insist the nurse that before and after giving the medication, they have to check the labels and identification of the patients before what is the dilution to be given, what is the dose to be given. This one they have to have the very clear picture of the things, what is the process to be followed in that. So in that, even after the dilution of the drugs, they have to make sure that the label is put in that. And even if there is a multiple, injections to be given, make sure that one by one it has to be, diluted and it has to be labeled. In that way, we have to ensure that all the areas, the safety has to be, ensured. Then it has to be again the double verification is the mandatory for the medications. When it comes to the supervisory level, see the supervision level, it has to be every time, everywhere, by everyone. That has to be double check. We have to always think of the worst thing what can happen with the medications, because sometimes it can go very severe way. These reactions can go into, because I can tell you one example of one of my friend. She had some antibiotics injectables. So after testing, she started having the severe reactions. They have given, doctor has advised to give injection adrenaline subcutaneously, but the nurse has given it is IV. So she was telling to me that she had a feeling that her heart comes out of the thoracic cavity. That feeling she had, it seems that was such a severe thing. So these all things we have to be, very clearly we have to, check all those things. We have to supervise it daily, all the shift, every time. We, especially the new nurses, their competency, they have to have a mentor first. Then the competency level have to be assessed. Then based on that, we are giving the credential and privileges we are giving to the people. So in that way, the supervision has to be. And if you see that if they require any repeated training, that also we have to give training in that based on the training need analysis. Then comes to the audit level, we have to see that the audits, how they are giving the medication, whether the rights are followed or not, identification. Even each parameters wise, we can go for the separate audits. So in that way, we have to see that, and if any error happens, we have to see that proper root cause analysis we have to do. Then make sure that the people is it should be non-punitive actually. And we have to make sure that they have to be, again, repeated training to be given. If they might require sometimes under supervision again, if it is required, when we get the trainees and all, we extend the training period for that, so that if they are not, they should come out in a very, excellent nurse. So that we have to do all efforts for that. So this way we can make sure that, and they should not be disturbed. The medication nurse who are listening, they should not be disturbed with it. There's a safe environment should be there for them to give the medications properly. So this all ways, we can make sure that the safety of the medications to be ensured. Thank you.
Thank you, Madila ma'am. You said very correct. Process training. Training, and training. That is the main motto. So,
And they should know about what the drug is to be used, and what is the complications. First, now I, as a nurse, I used to think about what is the, first I used to think that the benefit, more than benefit, what is the complications could have happened with this medications.
Perfectly, ma'am. So, as madam said, we want competent and privileged nurses. So, how do we attain this competent and privileged nurses is by continuous training. You did training, you gave training, but no, you have not finished it. You have to continuously give training. And second important thing is double verification. It all starts with the, indenting of the drug, from the indenting of the drug to the dispersing of the drug. All the things are, very important.
Yeah.
And madam, you also told about the supervisory level, madam, which is very important, because to make a competent and privileged nurses, supervisory level, supervision is a very important factor. So very correct, madam, and thank you so much for contributing it. And now I go to the next panelist. Next, let's hear from the learner side. Our student nurse can share challenges, observations from clinical posting, and how evidence-based guidelines support safe practice for beginners. So my question to you is, during your clinical posting, what challenges have you faced while administering medicines under supervision? Sri Priya, over to you.
Thank you, ma'am, for the question. I'm Sri Priya, fifth semester BSc Nursing student from Sri Narayana College of Nursing, Ernakulam. Deeply honored to be a part of this empowering hour hosted by ANEI Kerala Chapter. During my clinical posting, one of the main challenges that I faced while administering medications under supervision was managing my anxiety and ensuring accuracy, especially during my early experiences. I was very conscious about patient safety and the rights of medication administration. So I used to double check everything, and sometimes it made me slower than I expected. And another challenges that comes is becoming familiar with different drug names and its dosages and its route of administration. because many of the drugs have similar drug names and packaging, and which required me to stay very attentive and verify each one carefully. These are the some of the challenges that I faced. Thank you, ma'am.
Yeah, Sri Priya. So you said about anxiety, you said about accuracy. Yes, both things are, it collaborates. I am now thinking about my own experience as a student. So these all are our feelings also. Okay, to get into the accuracy, we always have that anxiety. So you said about patient safety. I have goosebumps when you say about patient safety, because we have taken classes for you during that patient safety month. So we have made, the ANEI has made a patient safety curriculum for these students. So now they understand what is patient safety. I really, appreciate Cipriya for telling that word, because that is very important in your, phase of clinical postings. So next I go to our transition to the faculty. So now any strong practice must start with strong education. I invite our faculty speaker to talk about how evidence-based medication safety is incorporated into teaching, simulation, and skill training. So your question for today is, how do you prepare students to follow safe medication practices from the beginning of their training? Over to Anita.
Thank you, ma'am, for the question. Good afternoon to all. Myself, Anita Sakarias, Assistant Professor from Sri Narayana College of Nursing, Ernakulam. First of all, I would like to thank Professor Dr. Simple Rajgopal, my principal, and all other ANI leaders for giving me the opportunity to be a part of this panel discussion. Ma'am, regarding the question, if we see nursing profession, future is definitely in the hands of our young budding students. Medication administration starts in the first year onwards. Importance of medication, if we see the administration and the safety principles will be started in the foundations of nursing theory classes onwards, and extensive skill lab training with the case scenarios, simulation, mannequins, and case discussions will be provided to our all students. And we sometimes utilize the role plays and checklist for the procedure and medication card, which all will assert their confidence to enter the clinical area after the skill lab posting. Then procedure manual is also available for us with us, so that also will help guide all the faculty in this preparation process, and that will help to avoid confusion. And there will be an observation period which is provided for all the students prior to the real procedure. So there will be supervised clinical exposure where they will administer drugs through various routes after 3 checks with close continuous monitoring. Students are always supported during the procedure, like helping in locating the area of injection, to sometimes injecting the drug by some of us sometimes. Then most of the time, making the students to administer medicine is a slow and strenuous and a systematic process. The medication rights and the safety guidelines are always emphasized to students. Now, this will be continued till they become confident and skillful to administer any type of drugs. Student faculty ratio is also maintained to reduce the errors. Then nursing officers are also very helpful in supervising the students in case if you are absent in the area. This is how we prepare the students in nutshell. Thank you, ma'am.
Thank you, Anita. I have been seeing Anita doing this in our hospitals. Whatever she was telling, yes, our future is our young buddy nurses. And with excellent skill lab, when they come to our hospitals, they are confident enough to do the procedures. And I have seen the students are doing it so confidently when they undergo all this process and when they come in front of the patients. Thank you, Anita, for bringing that into the light regarding the students training. So now I go back to Miss Saina Joseph. Saina, one more question for you. Are you there, Saina?
Yes, I'm here.
Okay, Saina, what advice would you give to the junior nurses to stay confident and safe while administering medicines?
Yeah, thank you for the question. So my simple advice to the junior nurses is to never rush the process of medication administration. Always take it your time to understand why we are administering and what we are administering. That you have to understand, and always follow the rights of the medication administration. If you ever feel that or you are unsure about the drug which you are going to administer, don't hesitate to ask your questions. There may be prescription errors also from the doctors also. If you are feeling that the drug is route or dose is not right, means you are empowered, you can ask to anyone like who is responsible. And that's not a sign of your that's a sign of your responsibility, not your weakness. So always double check with your senior person and refer the drug chart for the right dose, right drug and dose and all. And if you are in a doubt, and also build a confidence through the continuous learning. So I strongly recommend it to my junior nurses to develop a habit of studying at least one drug in a day. So by the end of the month, you will be able to you'll be able to confident, and you can be the masters of at least 25 to 30 drugs. And so that's how really we are building the confidence through the constant learning. And always patient safety come first, and confidence, so it will come naturally. And the most important thing, stay calm and focused while administering the medication, because our like distractions may cause the errors. And the final thing is, please report if there is any medication error happen from your hand, like that may be minor, major, that you have to report immediately. Because we all are working with the human beings, not with the machines. So if anything happens, we cannot replace the loved one of their family members, like that may be their husband, mother, kids, someone. So we cannot replace, like if I'm working on a laptop, accidentally something happened to that like equipment or like laptop, I can replace it, but we cannot replace the human life. So you have to report immediately if any minor error is from you. So that's my simple advice to the junior.
Thank you, Saina, for bringing out that word signs of responsibility. It is not the signs of weakness, right? Whenever a medication, when you have any doubt for any medication, that the sincere advice is that please recheck. Recheck with your consultant, recheck with your senior nurse, recheck with your supervisor, that are we doing the correct thing? That is a signs of responsibility. And actually, it is not a signs of weakness that I don't know what is the drug's dose and I don't know what is how the drug to be given. No, not an issue. You can always ask, and anytime you can always ask and give, rather than making an education error. Going to this process is more, correct. And Saina, one more thing I just want to ask: if at all a medication error is happening in your ward, how do you tackle it?
Because we have an audit system in our department. If I'm working in a ICU, so every day basis, we are checking the medication drug chart, like prescription chart and all. So if there is any medication error we find out, we immediately raise the incident. Even maybe it's a near miss, maybe it's a real error. So we will immediately report it as a incident report. And this kind of from the nursing in charges level and nursing managers level, we every day we are cross checking the drug chart if there is any errors happen from the nurses. So this is the way we are fine. And we have other teams like clinical pharmacists also daily checking the drug chart, and they are countersigning it, and we also countersigning it to ensure the safety of the medication administration.
Thank you, Saina.
Thank you, ma'am.
Saina. Okay, so I'll now again go to Lieutenant General Majana, ma'am. Ma'am,
Yes.
one more question for you. that what support can management provide to nurses to minimize the medication errors and stress during drug administration?
Thank you, Amita. Good question. Management, actually, the number of nurses is a parameter, actually. We should have enough staff members. Again, I stress upon the competent and privileged nurses we should have, and we should give the same assess the competency of the person. Mentor should be given, so that a mentor and all, if be given, the number of automatically the number of staff also go little high level. And again, strict instruction of the order to be given by the doctor, prescription to be given by the doctor. And for us, it is as a practice of this place. The doctor gives the prescriptions, and we can, in the AMR, it can be converted. Okay, the best option is the closed loop medications. There is a scanning of the barcodes. That is the best way of doing without any error. This will happen. But if a good EMR system also will help out, and when the as a system of us, it is. When the indent goes to the pharmacy, when they dispense the medications, it automatically there is a notification comes to the schedule the medications. Okay, once you schedule the medications, the alert of that high alert medications, it will be coming. And the start medications, if it is a start, if it is a stop, it will be moved to the other page. And the active drugs only it will be. So this all way, it is a good EMR system will help out the people to make very less errors for that. And we have to formulary to be updated yearly, or as an at least yearly it has to be updated. And the too many brands of medications should be avoided, actually. So if you are having too many brands, and again staff will have the confusion, doctors will have the confusion, these all things will happen. And pharmacy storage is also another important factor, because there should be a proper storage facility should be there, the light should be there, the temperature to be maintained, and should have the proper fridge for that thing. Even vaccination, we should have a vaccination room, we should have the separate fridge. And when the medicine comes to the wards, again the system of checking of that is, it has to be done. And there should be a proper cupboard, because keeping the medications at a patient's bedside is again it is not a safe idea. It has to be in the nursing stations with a individual locker or something. It has to be kept properly. And then the narcotics, again it has to be to be kept properly and handled properly, this all. And even the other medications like oncology medications and all, see, handled to be very carefully, these things to be handled. There are, again, I'm sure that for all, when you are doing so much of safety aspects, when you are looking into that, the number of staff also definitely to be, that proportion, it will be going up. And again, they we should have the monitors when we are giving some sedations or such medications. There are monitors are required for that. So the management supply, support with all those things has to be proper. In the wards also, we should have infusion pumps and syringe pumps. These all things are the mandatory to have the safe medication administrations. The nurse should not be disturbed while she's there should be a separate place for the medications to be handled. So these all ways, if you are that is the support what the management have to give to the staff. And even if some error happens, they have to be counseled properly for that, because otherwise they are, after all, if at all some error happens, they also will be under tension. So we need to have the proper training, retraining, and counseling, all those things to maintain the safe practices. Thank you, Amita.
Thank you so much, ma'am. You brought a very nice points, like EMR system makes it actually reduce the error to a great limit. because
Definitely.
you know that, yes, you know that the drug, if it is not in EMR, you have the paperwork and written by a consultant doctor. You are entering that drug again, intending in the computer in a
Yes.
system, and there you might have mistakes. And again, when you when you are administering the medication, again you can have, there are so many places there is no double check happening. Even if we say that you have to double check, there are two nurses in a department and one person is doing something, another person is doing medication
Definitely.
administration. So telling the protocols is good, but coming to practice, it is will be very difficult. So the double checking happens with the system. So that's the most important thing you have
Yeah,
pointed
yeah.
out, ma'am.
Yeah,
And
even we
second
have
thing,
the clinical pharmacologists on the floors, so they also, counter check, especially the discharge medications is been, explained by the clinical pharmacologist. So that also is, really helping the nurses to reduce some sort of, stress for that matter.
yes, ma'am. Yes, ma'am. Yes, ma'am. You told it very correct, because I also insist the same thing, and it has happened in our institution also. Because what they are comfortable is the nurses are explaining the discharge medication, and everybody is very comfortable. I'm not. I said, I'm not comfortable. I'm not comfortable because they are not, specialized in the pharmacology. They have only one topic which they are studying. So I wanted the clinical pharmacologist to come forward and, explain about the drug a few more lines. A few
Yeah,
more lines so patient can, understand what the drug is, because complaints of drug is very important. You have non-complaints of drugs. So many patients are admitted with non-complaints of drug, and I have even seen patients going, without knowing how to take insulin if they are starting for the first time.
Hmm.
So
Even here,
they,
the reconciliation of medication also is done by the doctors. So the, odd medications, whether it is actually required, can be stopped or not. All those things, it is done by. So it is, I feel it is comparatively those aspects, little stress free the nurses now.
yes, ma'am. Very, very correct. Because they should, everybody will understand that, because the nurses are, and when the patients are going on discharge, some admissions are coming up, some,
Yeah,
some busy things are going on. Somebody is doing medication administration, somebody is, attending some emergencies. So in between all those things, when you are explaining about the medications, I am not comfortable sitting in my office seeing this. So there, the management, the role of the management comes, that we
yeah,
have to
true.
convince the management that our nurses are not bad, but we wanted something more than what the nurses says. We want more competent persons to come forward and explain regarding the medications to the patients, so that non-complaints of medications are, reduced. So I have personally feel this regarding this. So it's a very valid point you have brought, madam. Thank you so much, madam. And you told about pharmacy storage. Yes, that is also another important this factor about pharmacy. Too many brands. Yes, too many brands. You all will agree to me that, too many brands, when the nurses don't understand which brand is now they are using. So the errors can occur in that way. They will just click, they will just write the first two three words, and they feel that that is the drug which is in the intending. So
Yeah.
again, there is chances of, getting wrong medications intending, and then not making the corrections, and again going into the error part. So thank you, ma'am. Thank you so much.
Thank you.
So I now invite Ms. Anita Sakriya. I just wanted to know that what are some of the common mistakes you observe among students, and how do you them constructively?
Thank you, ma'am, for the question. Mistakes, we do encounter mistakes sometimes. There was such an incident which happened in the emergency room posting. One of the student administered an antihypertensive drug to a wrong patient with the same name. So that the second patient, the whom the student had administered, had just arrived. So she called the name of the patient and that patient responded. And accidentally, and it had given to the wrong patient. And fortunately, the patient was found to be normal during the peak hours of the drug. And the student was very guilty. After that, she was fearful for 1 or 2 days afterwards. She became okay. And some other mistakes which we commonly see in the areas are like wrong identity, same the what I mentioned, wrong drug administration might be related to the legibility related problem. The prescription, what is written, the spellings, the students might be finding it difficult to read sometimes. So if they are communicating once again, it might be solved sometimes. But these mistakes are seen frequently. Then improper assessment. Improper assessment in the sense some drugs might be antihypertensive drugs. So students won't check the BP and blood pressure. Then they will go and administer it. So patient might be already on hypertension. Then insulin also same things are seen. They may not be noting the GRBS. GRBS might be checked, but they won't check how much it is. So according to the sliding scale, they are supposed to give the insulin administration. So this is also causing problems sometimes. Then next aspect is improper documentation. They will do documentation for some drugs they will forget or they will skip. So and reporting also. So if any changes in the drug aspect, the patient resists to have the drug, then the reporting is very important. Such reporting seems to be little bit less. From the student side, might be they are a little bit shy to communicate. Then inappropriate education on drug also sometimes seen, especially related to intradermal injections, etc. Test dose. Then students follow verbal orders sometimes, which is seen to be causing a lot of mistakes because they may not be as freshers. Fresh people, they may not be understanding the exact way to administer the drug, which drug, those things, clarification may not be there. Then they sometimes administer drugs prepared by other nurses. So students can politely refuse this, and they should be assertive enough to politely tell this. Then failure to follow the aseptic precautions sometimes, so for example, IV cannula related IV injections. So using a sterile swab, then keeping the cap on the hand, etc. Such things sometimes we find there are mistakes with related to this. Then alteration in the method of administration also, for example, syrup citralca, that is the disodium hydrogen citrate, which is given in urinary tract infection. So it needs to be diluted in water, then only it needs to be administered. But sometimes our children go and give it without any dilution. So that's a common mistake which we found. Then some patients takes their old drugs themselves. So without, they may not be giving them all the drugs to the counter, and they might be having automatically every day they are taking the drugs, so they will automatically take the drugs, and again this student will go and give the same drug. So if a proper communication is there, this also can be avoided. Then the corrections which these are the main mistakes which I have seen. The corrections are always given then and there itself in a polite manner without hurting the feelings of the students. See that it is not given in front, advices are not given in front of the patients. Then constructive criticism is often found, which is very motivating to the students. That is what they explain to us. We try to inculcate the feeling of empathy and integrity in students so that in our absence also they will be confident enough to do the things. Then details of medication errors are also shared and documented always to avoid such mistakes in future. Students are always encouraged to ventilate the errors. The students and faculty and the nursing officers work as a team for the betterment of the patient safety. Prompt reporting to concerned authority will minimize the patient's sufferings. And the third, victim reputation too. Students' physical and psychological issues sometimes may contribute to the medication errors, but which is not an excuse. Then faculty always handhold the students and the clinical side. So there is no such mistake created, and this will be taken care immediately without causing harm to the patient. Thank you, ma'am.
Thank you, Anita, for bringing all those points. I think the most important point is identifying the patient. You know, the right patient name and the UHID, which is the most important thing. That is the first thing the student should learn regarding the medication administration. If that is in the correct place, I think the most of the errors are, we can rid of the most of the errors. So identification of the patient, two identification aids has to be given to the students so that they are confident enough to move forward and confidently administer the medications. Thank you, Anita, for bringing all those points. And the last question goes to Sri Priya. Sri Priya, in the other way, I want to ask you that how do your instructors and senior nurses help you gain confidence and correct your errors in supportive way? It's a challenging question for you. Huh? She's already answered.
Thank you, ma'am, for the question. For the answer, when I make an error or I'm unsure about a procedure, they take the time to explain what went wrong and why, instead of just simply pointing out the mistake. They always demonstrate the correct techniques and allow me to try again and allow me to try again once. That helps me to improve my confidence and to do in a careful manner. Many of them also share their own experiences and practical tips, which helps me to understand my mistakes. Also, their encouragement have boosted my confidence and helped me to develop better clinical judgment and skills. Okay, they had always given me a constructive criticism, which helps me to ventilate my feelings fearlessly anything to them. Also, we have been never been punished for anything. Instead, corrected in a supportive way. Thank you, ma'am.
Oh, Sripriya, that was actually a very, nice way of speaking in front of your tutor. Good, great. You told that you get a constructive, criticism. That means a lot. That means a lot because you get confidence, so much of confidence in, doing any procedures for that matter. So, taking a correct way, what you are doing, because you all are doing a wonderful job by taking the errors. That's the most important thing when you are administering something or you are doing a procedure. If at all any errors occurs, please inform your tutors or the seniors or the head nurses present there so that immediately it can be corrected. That is the most important thing, Sripriya. So you have to taken it in a very correct way. Whatever your tutors has told, you have to take it in a correct way. Thank you, Sripriya. Thank you so much. So we have finished our discussion, ma'am. So any time left for the audience, or should I wind up?
Maybe you just
Or
ask one or two questions if
two,
anybody
one or
wants,
two
and then you can
questions,
wind up. Yeah.
if anybody wants to share some experience with 2 3 minutes, 2 minutes or 3 minutes left. I've seen Thangam ma'am in the
Yeah,
group.
please go.
Ma'am, Thangam ma'am, we would love to hear from you. Ma'am Thangam?
Tankam?
Yeah, I'm here. My throat is little bad again.
Okay, ma'am, not an
So,
issue. Softly you
so
can
I,
say.
I I would say first of all, very good discussion, fantastic, and also the audience number is great. So congratulations to ANEI Kerala. I have put a message already, and
Thank you, ma'am.
see, medication safety is a domain that can never get completed in 1 hour or 1 day or 100 hours, I guess. Because in my entire life, this is one area where nurses can make the huge difference because nurses are the last safety net the patient has. So all the discussion points that has been mentioned, they're all very, very valid. But I only tell one thing: whoever is going to the patient to administer, they just cannot take any shortcuts. If you are talking about, I will just add the last one is the documentation. 5 rights is mandatory. There is a lot of evidence coming out. There is no point in, training people on 11 rights, 15 rights. It just doesn't not work because when we have not even covered our 5 rights basics. But documentation, why I'm adding, because if there is no documentation, it is not done. So when you document, neither do it before giving the medication, neither you will take it till I finish my shift. It has to be immediately after administering the drug. So I think the self double check was, discussed during the session. See, the responsibility of the bedside nurse is paramount. And the responsibility of the seniors is to create a conducive environment for them to give this medication in a safe manner. Sometimes they are caught with too many things in the environment. So the leader's role is, of course, to ensure to look at the environment, the infrastructure, the process to make sure that they are rightful, rightfully supported. And I'm very happy to see the academic and the student discussing very important and very practical points. Every single point that was discussed is very, very valid. At the end of the day, the most important question is each one who is sitting here, what are you deciding to do different from now? If there is something that you have decided, I will do something different based on whatever role that you're doing, then this webinar is a great success because
Yeah.
you can do hundreds of webinars, but each one of us have to decide what is it that I'm going to do differently today. So I was happy when Saina was mentioning that at least, every day you learn one drug. So you will know at least 25, 30 drugs. One of the agreement that you should have is I will not administer a drug that I don't know.
Don't know.
Will ask somebody,
Correct.
is it right? How I have to give it. So take that, few moments. And I'm sure that, nobody will refuse to share that information. The doctors are willing to give it to you immediately. You just have to ask. That is very important. So these are some thoughts that came to my mind while I was listening to all the discussions. Very, very pertinent points were discussed by various, panelists there. Congratulations. Thank you. And we continue our endeavor to make our care for patients safe. So thanks, Kerala team, and thanks, Dr. Jyoti and
Thank you,
Madam
Tankam.
Kamaljeet for putting it
Ma'am,
all together so quickly. And we have very good attendance. Hopefully, that will shift our safety focus a little bit more.
Yes.
Thank you.
Thank you, Tankam. That was a wonderful wrap up. So I think we don't need any other extra point other than this because you have brought out everything very clearly. One thing I would like to mention here is right from the student to the leaders in the boardroom, everybody has got an opportunity to participate in the Empower Hour. So that speaks about empowerment. I was so happy to see the student and the Sino also presenting because I have seen them also during my assessments. It's amazing. Wish you all the best and continue to have the same power. Okay, whether you're a student or in staff nurse or sorry, we should not call staff nurse, it is a nursing officers. Okay, whoever it is, stay strong in whatever you do because ultimately the key is yours. If a prescription can go wrong, dispensing can go wrong, transcription can also go wrong, but administration cannot go wrong. So we are the first and the last line of defense, and very easily we can prove through medication safety. So thank you. And Amita, this is the first activity of yours after you have taken up the presidentship. Congratulations and thanks to all the officials who have completely supported her within the short span of time. And I also thank all the ex-officials of Kerala for being with us to make this as a success. Over to Amita and thank you all.
Thank you, Thankam ma'am, and thank you, Judy ma'am. I don't have anything else to say. I think the session has been, completed by all our senior officials here. But I think I will tell you one thing in the last, that medication safety is a shared responsibility, and every safe dose administered is a silent promise which is kept to our patients. That is the motto of our today's presentation. Thank you so much. Thank you all the panelists for joining and sharing such insightful thoughts.
Last
Thank
one
you.
point, you can take a group photo. People, whoever is there, can come on screen and then take a group photo. And don't forget to stop recording. The link has to be sent to Madam Thankam, because we need to have the recording shared with people, those who have not participated. So please take care of it, host and co-host. This point is very important.
Good
Abdul,
evening, ma'am.
can you
Good evening,
complete
ma'am.
photo?
Good evening,
Yeah, good
Amita.
evening.
Yeah,
Good
ma'am.
evening.
Dr.
Ma'am,
Simple, yes.
ma'am, can I
Yeah,
have a
simple.
minute, ma'am? I just
Yeah,
want to
Yeah. One.
congratulate.
please.
Fast.
Please go ahead.
I just want to congratulate Lieutenant Colonel Amita and my faculty who has participated, and also my student, ma'am. Thank you for the opportunity given. Thank you, sir.
Thank
Thank
you,
you,
Thanks a lot.
Dr.
simple.
Simple.
Thank you, ma'am.
Thank you, ma'am. Thank you for this opportunity.
Abdul,
Smile is same.
Tikan.
Sorry, I was mute. Did you ask me something?
Click a photo.
Okay, you wanted me to click a photo. Okay, one second.
Yeah.
Effective use of resources.
Yes.
One second now.
Thankam ma'am is not in the screen.
Is there?
Yeah.
Yeah.
Thank you.
Thank you so much.
Thank
Thank you,
Signing
ma'am.
off
Thank
of
you so
the
much.
day. Wish you all the best. Have a
Thank you,
wonderful
ma'am.
evening,
Thank you
all
so
of you.
much.
Yeah.
Thank you, Amita. Thank you, Amita
Thank
and
you.
team, Kerala team, for a wonderful
Saina,
presentation.
same smile, same brightness. Keep it up.
Yes. Thank you, ma'am.
Thank you, ma'am.
Thank you all. Thank you, Kerala team, for an amazing session. Thank you so much.
Thank you so much.
Thank you.
Thank you,
Thank
Madhavi.
Amita, you can disconnect from their end call.
For that recording, I have to.
Stop recording. You will get a link and you have to share that with